And for this screening assignment, we had orientation and tactile localization. And for this video, we're going to be talking about what tactile localization is, what population it most commonly affects, how to screen for it, and how to be able to tell if somebody is impaired in this area. Tactile localization can be described as the ability to localize touch sensation on the skin area. And functionally, tactile localization allows people to be able to feel clothing on their body and to identify and remove any irritating sensations they feel, such as an itch, or if a fly lands on their skin and starts to crawl around, they can swat it away. And it also allows for people to notice pressure on the body that is uncomfortable, like the pressure on the foot from a shoe that is on too tightly. Some of the population that commonly sees impairments from tactile localization include people who have suffered from strokes, traumatic brain injury, spinal cord injury, nerve damage, burns, and Williams syndrome. Williams syndrome is a genetic condition that is present at birth and is characterized by several medical problems, including cardiovascular disease and developmental delays and learning disabilities. And the technique for screening for tactile localization includes: the first step is to occlude the person's vision by using a blindfold or just asking them to close their eyes. And next, either using your fingertip or an aesthesiometer or even a cotton swab stick, you apply light touch to the uninvolved upper arm for 1 to 2 seconds, and then ask the patient to use their involved extremity to touch where they felt the applied sensation. And then you'll repeat these steps with the forearm and the palmar surface of the hand. And then you'll repeat the entire process on the involved extremity. And in order for the patient to pass the screen, they must be able to locate within 1 inch where the actual stimulation occurred. And if the patient is physically unable to touch the stimulated location with the involved extremity, such as if they had a stroke and they're not quite able to move that arm, the patient can verbally tell the therapist the exact location of the stimulation. And a sensory impairment is indicated if the patient is unable to locate the tactile stimulation within 1 inch of the actual stimulated area. And here is a brief demonstration on what a tactile localization screening will actually look like.
Okay, we're going to show you how to screen for tactile localization. So we'll start off by having the patient close their eyes so they can't see anything. And then on the uninvolved side, you're going to apply light pressure on the arm for 1 to 2 seconds. And then with their eyes closed, have the patient try and touch in that exact same spot. Okay. And then you'll go to the forearm and do the same thing. And then have the patient touch. And then on the palm. Okay. And in order for the patient to pass, they need to come within 1 inch of where you touched. So she did pretty good.
And then here are our references, and thanks for watching.